Diseases that give a respite from mobilization. What diseases are contraindications for service? When does a conscript get a reprieve from it, and when is he recognized as fit with restrictions? The answers to these questions are spelled out in the Regulations on Military Medical Examination, approved by the decree of the Government of the Russian Federation dated 04.07. 2013 and 565 ed. dated 29.06. 2022 in the section Schedule of Diseases. The Schedule of Diseases provides for the following categories of fitness for military service. A. Fit for military service. B. Fit for military service with minor restrictions. B. Limited fit for military service. G. Temporarily unfit for military service. D. Not fit for military service. If a disease of an organ or system of organs leads to a violation of the function of another organ or system of organs, an expert opinion on the category of fitness for military service is issued according to the relevant articles of the Schedule of Diseases. When examining citizens, in addition to the research methods given in the Schedule of Diseases, it is allowed to use more informative methods. The following abbreviations are used in the Schedule of Diseases. IND. The category of fitness for military service is determined individually. A2, B2, 3, 4 is an indicator of the purpose for military service. Schedule of Diseases. 1. Infectious and parasitic diseases. 2. Neoplasms. 3. Diseases of the blood, hematopoietic organs and individual disorders involving the immune mechanism. 4. Diseases of the endocrine system, eating disorders and metabolic disorders. 5. Mental disorders. 6. Diseases of the nervous system. 7. Diseases of the eye and its auxiliary organs. 8. Diseases of the ear and mastoid process. 9. Diseases of the circulatory system. 10. Respiratory diseases. 11. Diseases of the digestive system. 12. Diseases of the skin and subcutaneous tissue. 13. Diseases of the musculoskeletal system, connective tissue, systemic vasculitis. 14. Diseases of the genitourinary system. 15. Pregnancy, childbirth and the postpartum period. 16. Consequences of injuries, poisoning and other effects of external factors. 17. Other diseases. 5. Mental disorders. Endogenous psychosis, schizophrenia, schizotypal disorders, schizoaffective, delusional, acute and transient psychotic disorders and affective disorders, mood disorders are an absolute contraindication for service in the armed forces. Organic mental disorders are psychosis, other mental disorders, personality and behavior changes caused by brain damage and dysfunction, trauma, brain tumors, encephalitis, meningitis, neurosyphilis, as well as senile and presenile psychosis, vascular, degenerative, other organic diseases and brain lesions, neurotic states associated with stress and somatoform disorders, reactive psychosis, neurotic, dissociative and somatoform disorders, psychogenic depressive states and reactions, neurotic personality development, chronic post-reactive personality changes, as well as post-traumatic stress disorder, mental disorders caused by the use of psychoactive substances. Symptomatic and other psychoses and mental disorders developed against the background of common infections, intoxications, somatic diseases, HIV infection, other causes, alcoholic psychosis, chronic alcoholism, drug addiction and substance abuse with personality changes. Abuse of narcotic and toxic substances, cases of repeated intake of psychoactive substances accompanied by distinct harmful consequences in the absence of addiction syndrome. Only with pronounced persistent mental disorders caused by these diagnoses, a person is completely released from service. People with moderately pronounced asthenic, affective, dissociative, cognitive, personal and other disorders, as well as psychotic states with a favorable course can be recognized as limited fit. Those suffering from transient, short-term psychotic and non-psychotic disorders that have arisen as a result of acute organic diseases or brain injuries can receive a postponement if, after recovery, they retain slightly pronounced asthenia in the absence of signs of organic damage to the central nervous system. If there are no painful disorders after an acute brain disease or a closed craniocerebral injury, then there are no restrictions for the service either. They are subject to conscription as fit category and B, who are in stable, at least 1 year, remission after acute illness or brain injury in the absence of mental disorders and phenomena of organic damage to the central nervous system, when only individual scattered organic signs remain, without functional impairment. Single or episodic use of psychoactive substances, narcotic or toxic substances, is not considered a reason for postponement. With a diagnosis of mental retardation, reservists are recognized as limited fit for service if it is expressed to a mild extent. 6. Diseases of the nervous system. In neurology, there are many diseases that are called severe and even disabling, because with their progression, a person may lose vital functions or they are given to him with difficulty. These are infectious and parasitic diseases of the central nervous system, lesions of the brain or spinal cord and general infections or as a result of injuries, strokes, degenerative, demyelinating and inflammatory diseases of the central nervous system, ELS, Parkinson's disease, for example, tumors of the brain, spinal cord. If a person already has problems with vital functions or the disease progresses rapidly, they receive a white ticket. If the consequences and residual effects of central nervous system damage persist in the form of persistent neurological symptoms with minor functional impairment, combined with vegetative dystonia, asthenic syndrome, or even without functional impairment, a person can receive the status of limited fit for service or just fit, depending on his real condition. Those who have residual phenomena and consequences of diseases that are divided according to the degree of dysfunction of the central nervous system and limit the possibility of military service, but do not exclude it completely, are recognized as limited, and only those who can fully recover after suffering from the disease receive a postponement. A separate item in the schedule of diseases is epilepsy and epileptic seizures. This pathology exempts from military service if epileptic seizures occur with a frequency of 5 or more times a year. Limited service with a diagnosis of epilepsy is recognized if the epileptic attack has been a single one in the last 5 years or happens rarely, with a frequency of less than 5 times a year. They are suitable without restrictions if the epileptic seizure was in the anamnesis more than 5 years ago or the disorders identified by the results of electroencephalography do not manifest clinically. 7. Diseases of the eye and its auxiliary organs. In the list of eye diseases there are many pathologies that both completely exempt from service, chronic, difficult to treat or incurable diseases and the outcomes of injuries and burns, and preserve a person's ability to be either absolutely or limited fit for service. For example, a person will not be sent to service if diseases, injuries and burns of the eyelids, conjunctiva, lacrimal tracts, eye sockets, sclera, cornea, iris, ciliary body, lens, vitreous, choroid, retina, optic nerve have led to pronounced anatomical changes that have disrupted motor functions. A decrease in visual functions is progressing or the disease it often worsens in both eyes. But if the same problems are expressed moderately in both eyes or in one eye, they do not progress and rarely worsen, then the conscript can choose a place where he can serve with restrictions, shelf life category B, and if there is a chance to recover from a recent injury or burn, as well as an illness, then a person will receive only a postponement from service. The list of ophthalmological diseases is large. Retinal detachment, glaucoma, diseases of the eye muscles, disorders of friendly eye movement, persistent paralysis of the motor muscles of the eyeball in the presence of diplopia, the same, in the absence of diplopia, friendly strabismus in the absence of binocular vision, refraction and accommodation disorders, myopia or hyperopia, astigmatism of any eye. Each case has its own parameters for assessing suitability for service. In case of refraction and accommodation disorders, the degree of anomaly, the possibility of correction with glasses and lenses, visual acuity are important. With persistent paralysis of accommodation in one eye, optic nerve atrophy and other pathologies, the category of fitness for military service is determined depending on the function of the eye. It is clear that it plays a crucial role in determining the fitness for service. For example, benign neoplasms that do not violate the function of the eye are not considered an obstacle to military service at all. The postponement is granted to those who have suffered temporary functional disorders of the visual organ after an acute illness, exacerbation of a chronic disease, injury or surgical treatment.